Right now, we are engaged in a historic debate about the future of our healthcare system. The crisis has reached historic proportions, and Congress must act now. In 2000, family insurance purchased through an employer was approximately $6,700. In 2008, it has nearly doubled to $12,600. And if we don't act now, by 2016, family health insurance is expected to double again to nearly $24,300. We pay nearly twice the average of what other developed nations pay for health care, $2.2 trillion a year, more than 16% of our gross domestic product. However, the United States ranks 29th in the world for infant mortality. We have more than 47 million uninsured Americans. In 2000 and 2008, 86.7 million Americans, 1 out of every 3 Americans under 65, went without health insurance for some period of time. There is a hidden tax in America's health care system that all insured Americans pay to cover the cost of emergency care for the uninsured. More than half of the 47 million Americans who don't have insurance, the only care they receive is through the emergency room. In fact, that hidden cost costs about $1,100 for family insurance premiums and over $400 per year for individual insurance premiums. Every day we fail to act, 14,000 Americans lose their health insurance. We must provide affordable, quality health insurance to every man, woman, and child in this country. But we also must take additional steps to contain costs and make sure our system is more efficient. The healthcare reform plans that we're considering today will address a number of these issues. First, healthcare providers will be rewarded for the quality of care they provide, not just the quantity. Hospitals and clinics around the country will model the success at places like Bassett Healthcare, which is in Cooperstown, New York, and is one of the leading healthcare providers in terms of positive outcomes because of the quality of care. We'll also employ new methods to reduce medical errors through accountability and through healthcare IT, and to prevent costly illnesses through better care management, through diet, exercise, and preventing diseases such as preventing childhood obesity. Second, we will address the needless red tape and excessive administrative costs in our healthcare system. Senate Health Insurance Reforms combats this problem by setting administrative standards that insurance companies must meet and provide new tools to combat fraud. I would like to see a universal one-page form that all people can use for reimbursements for all insurance companies. That can be submitted online. Changes like that could really transform efficiencies in the market. Finally, we will make use of the healthcare technology that could reduce healthcare spending by $77 billion a year. Currently, just 1 in 25 American physicians utilize fully functioning electronic medical records. Senate Health Insurance Reforms expands the use of electronic prescribing, electronic health records, and electronic support for diagnosis and treatment options. Studies have shown that 1 out of every 4 tests are needlessly done because there's no record of that test. This must change. We know that the nation's healthcare costs are steadily bankrupting our government and our citizens, and we owe it to every generation that comes after for us to act now.